So good afternoon. Today we're going to provide an update on medical supplies, new field hospital capacity, courtesy of the Boston Convention and Exhibition Center, the City of Boston, Partners Healthcare, and a number of other healthcare organizations here in Boston, and unemployment claims and benefits. Last night, as many people know, we got word that we're getting an additional 100 ventilators from the federal stockpile. We'll test them as soon as they get here and deploy them to the hospitals in the Commonwealth based on the criteria and the guidance that was established by the Medical Advisory Group. We also received a wonderful donation from Boston Children's Hospital of 5 ventilators, which we're enormously grateful for. And obviously that is a very special institution that every day provides amazing care to kids, not just in the Commonwealth, but across the country and around the world. Obviously, we continue to be focused on a pursuit of ventilators through other means and other channels as well. Given our projections about how much worse this pandemic could get, we obviously know we need more, and we will continue to work every avenue we can to get them. Earlier today, I signed 3 executive orders to help expand healthcare capacity and ensure access to inpatient services. The first order makes it easier for foreign-educated doctors to be licensed to practice here in the Commonwealth. Specifically, the order allows graduates of international medical schools who have completed at least a 2-year postgraduate training to be licensed here in Massachusetts. The second order allows nursing student graduates and those in the last semester of nursing programs to practice nursing here in Massachusetts if they are supervised by a licensed medical professional. These orders will contribute to our efforts to grow a robust community of frontline workers to support our healthcare institutions statewide as they significantly expand their capacity to deal with the surge. We've already cut red tape to allow more healthcare professionals to come over state lines, come back to work, or start practicing straight out of school, and to continue to make sure that we find the resources that we need to support our residents. This is particularly important as we bring more field hospitals like the BCEC site online, because we need the staff to support this extensive network of operating facilities. The last order I signed provides that insurers cover all medically required costs with no charge to the patient. Again, this order is important as we stand up new facilities for healthcare that may be considered out of network under normal circumstances, and will ensure that individuals will be covered who go to those alternative locations for their medical care. I also want to give a quick update on our efforts to build out field medical stations to accommodate the surge. As we outlined last week, our command centers worked with Commonwealth's medical community to model the growth of COVID-19 cases so we can understand how we'll need to increase our hospital capacity. To reduce the strain on our hospitals, we've been working with a wide range of partners to set up field medical stations at locations across the Commonwealth to add a significant number of beds to our system as we approach the surge. Each site will leverage the unique experience of local healthcare partners. For example, the first medical station in Worcester is being staffed by the dedicated team at UMass Memorial Hospital, and special shout out to Eric Dixon and his team for their work. Today we're here to announce the details for the Boston Field Medical Station at the Boston Convention and Exhibition Center. To launch this site, our administrations worked in close coordination with the Command Center, with Mayor Marty Walsh and his team at the City of Boston, our colleagues at the Convention Center, and of course Boston's remarkable and talented healthcare community. Today we're excited to announce that Partners Healthcare will be leading clinical care efforts at the Field Medical Station at the Boston Convention and Exhibition Center. As we all know, Partners has a huge footprint here in the Commonwealth, and the hospitals in its network, Mass General and the Brigham among them, are some of their very best in the world. Partners' clinical effort at the Convention Center is called Boston Hope, and leverages a partnership with Boston Healthcare for the Homeless to care for what we expect will be a large and diverse population of COVID-19 patients. As a result of this clinical effort, the Boston Convention Center will eventually provide an additional 1,000 beds for COVID-19 patients. 500 on what we think of as the medical side, and another 500 to help shelter providers and serve homeless populations here in Greater Boston. Dr. Ann Klebanski, the CEO of Partners, is with us today, and in a few minutes she'll speak to the specifics of the Boston Hope clinical effort. But for now, I just want to say, on behalf of the Commonwealth, thank you for bringing your people, your knowledge, and your innovative spirit to bear in this fight. Partners' workforce and institutions have already done a lot for the Commonwealth's COVID-19 response. And of course, the incredible work of the medical professionals at all of our Boston hospitals will be crucial to the healthcare system's response to this pandemic. Labs at our hospitals have also contributed to a significant increase in testing capacity and output. And Partners, I think, as many of you know, because both the Lieutenant Governor, Secretary Sutters, and I have spoken about this before, was instrumental in the identification and delivery of the machine from Battelle out of Ohio, which is standing up a new facility in Somerville where that critical care decontamination system will be able to sterilize 80,095 masks a day, which obviously means that our N95 mask stockpile will go a lot farther than it would have without the machine. And I do believe there are only 4 or 5 sites like this that are currently set up anywhere in the country. And I just want to give the folks from Partners, the folks from the Mass Hospital Association, Mayor Joe Curtatone, and the folks in Somerville, and the folks on our team, a big shout out for making Massachusetts one of the few sites in the country that is going to be able to use a facility like this to dramatically extend the life cycle of some of its personal protective equipment, and in particular those N95 masks for our healthcare workers, our emergency responders, and our first responders. We're grateful for the support from the City of Somerville for their efforts to make this happen. The machine will keep more masks in use, sustaining our supply of this crucial personal protective equipment for all the folks who are leading the charge in the fight against COVID-19. And now with the launch of Boston Hope and this new effort at the BCEC, Partners is stepping up to do even more, and we are very, very grateful. Mayor Walsh and his team have been working around the clock to bring the Boston Field Station and the Boston Convention and Exhibition Center online, and without them, this critical effort would not have been possible. This will also come in conjunction with the opening of the Newton Pavilion, which is a joint initiative between the Commonwealth of Mass, several of the shelter providers in the City of Boston, Boston Healthcare for the Homeless, Boston Medical Center, and the City of Boston, which will also offer another 250 beds to help shelter and care for the homeless community here in Boston. This morning, new data released by the Federal Department of Labor revealed that nearly 140,000 new individuals had filed for unemployment in Massachusetts last week. All in the last 3 weeks, nearly 470,000 individuals filed new unemployment claims. And to put that number in context, typically in Massachusetts, over the course of the past 6 or 7 months, we would get roughly 7,000 to 10,000 new claims a month. So 470,000 over 3 weeks versus what would have been something more in the vicinity of 10,000 to 20,000, maybe 30,000 new claims over a 3-week period under normal circumstances. These numbers obviously are staggering, and we all know the story behind all of them is about more than just numbers. Between every new claim is a story of economic disruption and hardship caused by the unprecedented impact of this virus. We all know the virus has caused people to lose their jobs, almost all cases through no fault of their own, and has created significant anxiety in households across the Commonwealth and across the country. We know several people have had trouble getting through the website and are frustrated waiting for callbacks. I want you to know that the administration is working this one hard, and we continue to expand our capacity and develop new resources to help people who are filing applications. We're glad the online system that we have has been able to withstand the new volume without crashing. That hasn't been the case in many other states, and that's thanks in large part to the work we did to migrate the system to the cloud a few years ago. But the sheer volume of this new influx means we have to do more, and we know that. The Department of Unemployment Assistance has been working nonstop, and as of today, DUA is paying unemployment compensation to over 250,000 Massachusetts claimants. But given the historic volume of new claims, we know that a large number of people are still working through the application process, which often requires, in some cases, a personal connection from DUA's customer service staff. And we recognize that that is frustrating for people, and in many cases, small mistakes on those applications can prevent a claim from getting processed right away. In a situation where people need to access unemployment benefits quickly, it's crucial that we do what we can to help resolve those issues. And that's why we've aggressively scaled up DUA's customer service staff from around 50 people working in a single call center 3 weeks ago to over 600 people working remotely today. And that team has made over 60,000 calls back to constituents to help them resolve their issues and get their claims and their applications processed. That group is now making over 6,000 calls per day, and that number will continue to trend up as we go forward. DUA customer service staff has been calling claimants basically 7 days a week for the past 3 weeks, and will continue to work through the weekends until everyone receives a call back and gets their issues dealt with. And for the past 19 days, the DUA has hosted daily virtual town halls, both in English and in Spanish, which have now been attended by over 100,000 constituents. They're focused on helping claimants resolve common issues that may appear on applications that are preventing people from successfully completing the process. And in the coming days, the department will launch a new mobile-friendly Spanish-only application to help those who are facing language and technology barriers in the legacy UI online interface. We also know that many people are eagerly awaiting information about the new federal benefits that were included in the CARES Act passed by Congress last month. Since that legislation passed, we call basically every day to try and get guidance from the feds about how they plan to implement those 3 new unemployment benefit programs. And this week we received partial guidance from the federal government on the CARES Act, and we're beginning to distribute benefits to some of those residents. That first program is an additional $600 per week for regular unemployment compensation, which is typically what most people in the system apply for and receive. As of today, all eligible claimants will receive an additional $600 weekly benefit. People applying for new claims or who are already receiving claims do not need to take any action to receive this benefit. And as I mentioned, this only impacts a particular group of applicants. It applies to both to claimants who are currently receiving unemployment and to those who are applying currently. And the benefit is retroactive to March 29th and will continue until the end of July. That's the $600 additional benefit. Right, basically runs for 4 months, end of March, beginning of April, through the end of July. The second program is expanded support for people who have not traditionally been in the unemployment system. People like self-employed workers, folks who are consultants and receive 1099s from those they do work with, and folks who are in the so-called gig economy. For this new program, the DUA is working with a vendor to build a platform to disperse those benefits, and that platform is expected to begin processing claims by the end of this month. That will provide up to 39 weeks of unemployment benefits to these workers who are not filed in, located in, known by the existing unemployment insurance system, and are therefore people we need to build new files for. People interested in applying for this program should check the website at DUA for updates, and we'll communicate with the public when the program is ready to accept applications. The third program is a 13-week extension of benefits for people who have exhausted their previous unemployment benefits. That program's not available yet because the DUA is awaiting federal guidance around how to implement that initiative. Eligible claimants should continue to check for updates, which will be made available as soon as the state receives information from the federal government. I think we know this is frustrating for many, many people here in Massachusetts. People who've lost their job through no fault of their own and are trying hard to access funds that they need to get by. And the new Federal CARES Act, those benefits haven't been able to be made available as quickly as any of us would like. but you have our commitment that we're going to continue to do all we can to get the resources out the door to help workers that are impacted by this unprecedented situation. And we will continue to ping our colleagues at the federal level every day to encourage them to get us the guidance we need to effectively, appropriately, and lawfully implement those new pieces of the law. And we will continue, obviously, to update the public as more information becomes available relative to this situation. And now I'd like to welcome the Lieutenant Governor, Karen Polito, to the podium.
Thank you, Governor, and good afternoon. These last few weeks have been an incredibly trying and difficult time for all of us, not only here in the Commonwealth, but for people around the world. And in some circumstances, these necessary steps of social distancing and staying home have left survivors of sexual assault and domestic violence particularly vulnerable and at an increased risk. Think of that for just a moment. Being home, isolating or quarantining or working from home, living with an abuser, and the impact that that has on your mental and physical abilities. So today, we want to make clear that as part of the work we are doing to stop the spread of COVID-19 and the efforts we are bringing forth across the Commonwealth, that survivors of sexual assault and domestic violence know that they are not forgotten and that we are here to provide resources to support them and to keep them safe. Since this crisis began, we have been in constant contact with our partners in the fight to end sexual assault and domestic violence, particularly Jane Doe, SafeLink, and our community providers across our Commonwealth that make up our safety net. I'm grateful for the advocates in local rape crisis centers, as well as domestic violence programs across our Commonwealth who have rapidly transitioned to providing many of their services remotely, utilizing technology to continue supporting survivors. I'm incredibly thankful for their efforts to make sure survivors have the services they need, and we will continue to work closely throughout this crisis. As we continue to have discussions moving forward, DPH will update and post guidance and resources online at the COVID-19 website and their sexual and domestic violence prevention and services site. This is a critical time, especially for survivors. And to any that might be watching, know that you are not alone and that there are resources available to help you. Although many of the physical spaces of these resources have temporarily closed, we want to ensure everyone that they know that there are resources still available to you. This includes accessing to file abuse and prevention and harassment prevention orders either through your local police department, connecting with a safe plan advocate, or through our courts. Courts can also be reached during the normal business hours by calling the court directly or by calling the trial court hotline, 1-833-91-COURT. In fact, I spoke with Chief Dolly today. Judges are available 24/7 to process 209A restraining orders. Today we are announcing the expansion of SafeLink. This is a statewide 24/7 toll-free confidential domestic violence hotline. Prior to the COVID-19 outbreak, SafeLink functioned as a hotline to protect and connect survivors specifically to domestic violence services. Now, during the public emergency, we are expanding SafeLink's capacity to include connecting victims of both sexual assault and domestic violence to the rape crisis centers, as well as local domestic violence programs in their communities. SafeLink's expanded capacity to triage calls to local rape crises center hotlines creates a centralized number for any survivor of domestic violence or sexual assault to call and receive services. As of yesterday, this resource is now available through 211 as an additional avenue for the most vulnerable to access help. SafeLink will continue to be operated in its expanded form by Casa Myrna, a Boston-based domestic violence provider. The SafeLink toll-free number is 877-785-2020. And for those who are hearing impaired, the SafeLink number is 877-521-2601. Advocates are available in English and Spanish and can provide translation in more than 130 languages. SafeLink is confidential. It allows callers to discuss their experiences and needs with a trained advocate who will then talk with them about potential options and link them to local domestic violence or rape crisis programs. This hotline is designed for crisis intervention support for those who need assistance in safety planning measures for both themselves and their families. A specific message. If you have experienced sexual assault or domestic violence within your home, or are concerned about a loved one who may be experiencing violence, please call SafeLink and support them and connect them to the resources they need. If you are in immediate danger, of course, call 911. I also want to reiterate the message that sexual assault nurse examiners, also known as SANE, are still available in 36 hospitals across our Commonwealth during this time to provide forensic testing and to provide support to those who need these critical services. Information on the hospitals where SANE can be found at mass.gov. We know that during this time, individuals are still experiencing sexual violence, and it may be necessary to access direct forensic testing. So if you or someone you know has been sexually assaulted and is in need of sexual assault forensic exam, please go to your nearest emergency room department for care. And even during this difficult time, as we deal with the limits of our healthcare system, please know that there are trained professionals that can assist you, walk you through the collection process, and connect you directly with a trained advocate for follow-up and support, regardless if you are ready to report the incident to law enforcement or not. April is Sexual Assault Awareness Month, and normally as the chair of the Sexual Assault and Domestic Violence, I would be in communities working with providers to promote these programs in person. But today, living in a COVID-19 environment, the point of the message is to explain that these services are still available, and our partners across the Commonwealth are active and have made that transition to provide these services to you remotely. Clearly, these are unusual and uncertain times, but we know that survivors and victims will continue to be part of our strategy, our response, and top of mind. And in every part of our Commonwealth, we are engaged and we talk daily about how to do this better. Friends, family members, neighbors, and coworkers all have a role to play too. You can make a difference. And in this time of physical distancing, it is critical that we maintain social connection, especially for people who have experienced sexual and domestic violence, who are at greater risk when they are isolated from support. If you know someone struggling with issues related to sexual or domestic violence or assault, let them know that they are not alone. Call, email, text, and get them connected to a local program. You can call to ask for advice as well and find creative ways to support them. If you are at home with someone who has abused you, please call for help when you can see the person but are far enough away that they can't hear you. This is the best way to ensure that reaching out for help does not further endanger you. And again, if you are in immediate danger, please call 911. If you cannot safely call or are not comfortable doing so, you can instant message with a trained advocate at the National Domestic Violence Hotline at www.thehotline.org or www.loveisrespect.org, or through the Rape, Abuse, and Incest National Network, www.rainn.org. I would like to just take a final moment during Sexual Assault and Awareness Month to let survivors know that we see you, we believe in you, and we are here for you. Thank you. I'd like to now turn it over to Brian Golden of the Boston Planning and Development Agency. Thank you, Brian.
Thanks very much, Governor Baker. Thank you, Lieutenant Governor Polito. Very soon, the Boston Hope facility will be open, and I'm here to express Mayor Marty Walsh's gratitude for all the work, all the effort, all the collaboration that has brought that about. Mayor Walsh and all of us at City Hall and throughout city government are grateful for this whole of government approach, really a whole of society approach to establishing Boston Hope, a 500-bed hospital and a 500-bed facility for unsheltered, vulnerable populations. It was federal, state, city, and Boston Convention and Exhibition Center staff who worked hard on this. It was the medical and human services community that have worked day and night over the past week to create Boston Hope. It's also about private sector entities that have retooled their businesses expeditiously to make sure that food would be ready to go for thousands of people in the coming weeks. Laundry, janitorial services, medical equipment and non-medical equipment, furniture. This was a massive undertaking, and it's remarkable to see it come to fruition in just 5 or 6 days. In a special way, the mayor wants to thank the men and women who built out this facility. It is really awe-inspiring to lay eyes upon a facility that will house and care for 1,000 human beings for weeks. And again, it was created in just days. So thank you to all those who brought this about so quickly. Boston Hope is the perfect name for this special place. Mayor Walsh insists that the city go about its business with hope. There is no time for discouragement. There's no time for fear. We are working focused on hope and the expectation that if we work hard, we work collaboratively, we make good decisions, we can bring about the healing of the city of Boston, the healing of the Commonwealth of Massachusetts. And I thank everybody involved, again, on behalf of the mayor, for the effort that has brought about Boston Hope. Thank you very much.
Dr. Ann Klebanski, who's the president of Partners, is here, and you want to talk a little bit about this, since you folks are going to have a big role in making it happen?
Good afternoon, and my thanks to Governor Baker, Lieutenant Governor Polito, and the opportunity to join you today. So you've heard a lot about Boston Hope, and what I'd like to do is make some comments about things we've been planning for and where we are today. We began planning for the COVID-19 pandemic several months ago, really working to mobilize resources, organize staffing, and start to plan for the long-term impacts of this virus. There were many unknowns, there still are. There were many projections, there still are. But thanks to Governor Baker, Lieutenant Governor Polito, all of the teams here, and a thanks to Secretary Sutters, we've really advanced an enormous amount of work to really ensure that we're able to care for patients. Secondly, to support our communities and to really, again, mobilize resources needed to do this. And I would say we are extremely grateful. Grateful to the teams here, grateful to the partnerships, grateful to the city, and grateful to all of our employees, all people around the city and the state who've really come together at this very critical moment. I'd like to focus on two things. You've heard about them from Governor Baker and others, but it's really on personal protective equipment, or PPE, and some specific comments about Boston Hope. So early on, we became concerned about the availability of personal protective equipment, and particularly masks for our workforce. We've all heard a great deal, and I would say many of us have experienced firsthand this issue over the past several weeks. We knew we needed a solution. We needed a solution quickly. And working with Governor Baker and his administration and Mayor Joseph Curatoni and his staff, we entered into a partnership with Battelle. And you've already heard a bit about private and public partnerships. Partnerships is one of the themes of today, and it's certainly, this is an example of one of those partnerships. So Battelle is a global research and development organization committed to science and technology located in Ohio. And they developed an innovative solution for decontaminating masks. So this became very interesting, very exciting, the possibility of being able to decontaminate masks, be able to extend the life of a mask, to have less mask utilization when resources were scarce. That was a very important issue for us to take on. Mayor Curatoni worked to secure a location at Assembly Row using emergency powers granted to him as part of the Somerville's response to the current health crisis. So this innovative partnership will offer hospitals across our region, first responders, and medical professionals a new regional resource in the battle against COVID-19. And I'm emphasizing the regional resource because so much of what we do is really defined by the interconnectedness of who we are as a community and as a state. It's an important tool for us as we deal with the predicted surge of patients with this virus. You've already heard that the system will be operational later this week and has the capacity to decontaminate up to 80,095 masks a day. So the impact is clear if you look at a few numbers, and I just wanted to give you a few numbers, maybe to give it a little bit of clinical and other context. So we look at over 16,000 patients with a COVID-19 diagnosis at the end of the day yesterday in Massachusetts. Approximately 569 of those patients were at one of our partners' hospitals at the end of the day yesterday. And as a healthcare system, partners, soon to be known, as many of you know, at Mass General Brigham, we started to look at what our requirements would actually be. So we require 13,000 masks for our hospitals per week. And that number, if some of our projections are correct, could reach up to 45,000. It's a very large number. And we're caring for patients with COVID-19 in our hospitals now, but of course, we have to be prepared for the surge, and we have to be prepared in a very thorough and reasonable fashion. We can't get this technology up and running fast enough as a resource for the city and a resource for the state. So the second important partnership in this war against COVID-19 I'd like to highlight is Boston Hope. You've heard quite a bit about that already, but I would first like to say that thanks to the decisive leadership and collaboration with Governor Baker, Lieutenant Governor Polito, Secretary Sutters, and Mayor Walsh. It was such a pleasure to announce this morning that partners will lead the critical care efforts for Boston Hope. This is really a facility for patients being treated for COVID-19. You know it's located at the Boston Convention and Exhibition Center. But I'd like to take a moment just to highlight two important benefits and important points about Boston Hope. First, in this 1,000-bed facility, we will be able to care for the unsheltered in a protected setting. And you've already heard the 500-500 projected split, but I want to just point out that these are all part of a single effort to contain this virus and provide care for our patients. And second, by transitioning patients with COVID-19 from our acute hospitals to Boston Hope, we can make more beds available for patients in our acute hospitals who require the level of care being delivered at those hospitals. And I really can't emphasize this enough from a clinical perspective. We must provide the right care to patients during this pandemic, and it's so important that we ensure that patients receive the right care at the right place. So there are so many patients at our acute hospitals who need ICU and other higher levels of care availability. A significant percent of our patients who are hospitalized in an acute care setting, it can be up to 40%, will require this intense care. How do we change the configuration of our acute care hospitals to take care of this need? So for patients recovering who need continued care, but not at our acute hospitals, this facility is critical in meeting that goal. Patients will come from hospitals across the city and across the region. Some will come to this facility as they transition from our acute care facilities at Mass General or Brigham and Women's Hospital. But I can't emphasize enough the collaboration that is already occurring at a daily and sometimes hourly basis among our hospital leadership across the city and across the state. So we expect and welcome hospitals and healthcare systems across the city and beyond. Those who need those services, they can send patients to receive the care that they need from medical professionals who are there. And others, of course, will come to the facility because they are currently unsheltered and need to be in the space as well. And Boston Hope will begin accepting patients for care tomorrow. I would just comment quickly that General Jack Hammond and a very strong team of healthcare professionals, logistics experts, contractors, and more have really worked tirelessly for the past week or so to make Boston Hope a reality. If you see what's going on there, if you look at the beds that have been stood up almost overnight, the incredible work that has been done by this team that has gone on throughout our healthcare system, other healthcare systems, and the state, it is only then you see the reality of what has been accomplished. So I think we should all be proud of this, how many have come together in such a short amount of time to make this happen. The clinicians, the support staff, and so many others from across our system and across the regions, they're raising their hands and asking how they can take care of patients. Staffing has been a challenge, it has been an issue, but seeing the number of people who have come forward, seeing the creativity, seeing the willingness to serve is what is making us be able to move forward now. So, as you know from others, and I'll just endorse this as well, Boston Hope is a very significant undertaking. The response from so many in this time of crisis has been nothing short of inspirational. And that support has come from everywhere and coming from expected sources, unexpected sources, and it does, and I think will continue to amaze me and all the rest of us. So I would just say in closing, as a physician, I would say that we need to rapidly do many things in parallel at a time of uncertainty to really make and take the best care of patients and also to protect as many people as we can now and also going forward. So my deepest thanks to the entire Baker administration partnership during these really unprecedented times, and my thanks to all of those who have stepped forward from our healthcare system, from healthcare systems across the state, and many others from so many different sectors to bring this project forward. Thank you.
Good afternoon. Thank you, Governor, Lieutenant Governor, our good friends from the city, and Partners Healthcare. It is truly remarkable, as you were up here speaking, Dr. Klobansky, it was only, I think, 6 days ago when we actually solidified the planning, and now it's actually stood up. It really is pretty remarkable. And the license was approved also. Always a good news. So just a few updates from the command center. As you know, on March 31st, we created a safe on-site mobile COVID-19 testing program for first nursing homes and rest homes. The program allows for safe on-site sample collection by trained personnel from the Massachusetts National Guard. Facilities receive the test results in just 2 to 3 days, which allows staff to more quickly take steps to mitigate the spread of the virus. To date, the team has conducted on-site testing of 2,031 residents at 122 nursing homes, rest homes, and a few assisted living residences. There are a few important changes to the program. They'll be rolled out today and tomorrow. One, we're expanding the team to 250 members of the National Guard in order to increase our testing capacity and to offer on-site testing at all assisted living residences who want to be tested. There are approximately 16,500 seniors living in assisted living residences across the Commonwealth. In addition, nursing facilities that have available healthcare personnel on site can now request to receive the test kits to perform sample collection themselves, rather than having the National Guard specialists perform the testing. These facilities will follow the same process to call our designated and dedicated hotline. Yesterday, as you know, we announced that it was very important for race and ethnic data to be reported. The command center worked to increase testing capacity, as you know, as quickly as possible. COVID-19 testing is currently conducted by dozens and dozens of private labs, hospitals, and other partners. And we're working with these organizations to improve data reporting by race and ethnicity, to better understand where and on whom the burden of illness and death is falling so the Commonwealth can respond more effectively. Yesterday, we issued an order, a public health order, requiring that healthcare providers shall take every reasonable effort to collect the complete demographic information, including name, date of birth, sex, race, and ethnicity, address, and telephone number on patients with confirmed or suspected COVID-19. And that information must be included so that we have full information available to the citizens of the Commonwealth. Yesterday, for the first time, we released the data, acknowledged how incomplete it is. It's not where we want it to be, but we will work with our partners who report the data to make it better. And we will continue to report the data on a daily basis. And finally, I'd like to announce a new job application for COVID-19 temporary care sites website. As we prepare for the surge of Massachusetts residents who will need medical attention and other supports for COVID-19, we have been standing up temporary care sites and long-term care facilities across the Commonwealth. You heard about one today. All of the surge sites set up in Massachusetts, from the DCU Center Field Hospital to the dedicated skilled nursing facilities, need staff to care for COVID-19 patients. In addition, many of our existing nursing and long-term care facilities are already facing urgent needs for staffing support. We are kicking off an all-out statewide strategy to connect healthcare professionals to these sites by recruiting laid-off workers, volunteers through Mass Response, and National Guard medical staffing. This new website, mass.gov/joincovidteam, is a central place, one central place for job seekers to connect with temporary care sites that need employees. On this page, you can find job opportunities with each of our healthcare partners that is joining forces to care for COVID-19 patients. These care sites are hiring for a variety of roles across healthcare and human services, from respiratory therapists to housekeepers and nurse aides. We'll be reaching out to job seekers and students through educational institutions, the alerts mass text messages, and recently furloughed and laid off healthcare workers through the Department of Unemployment Assistance to ensure that we're reaching a wide group of people. We have jobs available. As the surge rises throughout the state and other temporary care sites dedicated to COVID-19 stand up, we will continue to update this website with new job opportunities to register for. So please continue to return to this link, even if you did not find the right opportunity the first time you checked. We are building a strong COVID team to help residents battle the pandemic. Help us fight back on the front lines by going to mass.gov, join COVID team to see specific hiring needs for each site. If you want to make an impact in this fight, opportunities for jobs at the BCEC, which you just heard about, as well as working with elders and other opportunities in our great Commonwealth, please go to mass.gov, join COVID team. Thank you. Governor?
Questions on any of this?
Can you talk about where we are at, where the state is at right now on this slope, and also if I could get your thoughts
On which?
on the slope, on where we're at on the slope right now for Massachusetts, and also Dr. Fauci is saying U.S. fatalities could be lower because of measures like social distancing. Do you see that as a possibility here?
Well, Dr. Fauci's obviously a lot more qualified to comment on that question than I am. I think what I would say is that we track the percentage of people who test positive out of the number of people we test every day, and we're in constant contact with our colleagues in the hospital community especially around what they're seeing with respect to both their EDs, their front doors, and their ICUs. And based on that data, it looks pretty clear to us like the surge is going to land about when we thought it was going to land, which is somewhere between the 10th and the 20th. We've been asked many times about how long it's going to last, how high the peak is going to be, that sort of thing. Those are really hard questions to answer because we're dealing with something that most people have not dealt with before. And we've built most of our models off the experience that other countries and other regions have had in other parts of the world. But again, they're just a model. And as Dr. Klibanski put absolutely beautifully, a model is a model is a model. And what we need to do is make sure that we plan as best we can for the surge here in Massachusetts, and that we do all we can to make sure our medical professionals and our healthcare organizations have the resources they need to serve people during this period. But I don't have a crystal ball with respect to how long it's going to last or how high it's going to go. What I do have are a whole bunch of models and estimates, which and historical data to the extent it's available, and we've taken that and working with our colleagues in the healthcare community, developed what we believe is an appropriate increase in capacity to serve the people here in the Commonwealth during this surge.
Governor, are you concerned that with the flattening of the curve, we could get a false sense of security? There's a lot of talk nationally in New York about flattening, lower death toll rates, and people are going to start wanting to go outside again and get back to work. Are you concerned that we're going to be too fast to go back to normal?
Well, I've also said several times that I think it's important for us to not make big conclusions out of small amounts of data. As tempting as that may be to do, especially if the data looks better, because of the anxiety that's created by the presence of this virus and the impact that it's had already. I do think what I would say is that most of the modeling that's been done does not imply the same thing happens everywhere in the United States at the same time. Because there are trigger events. You know, part of the trigger in New York, according to a lot of the stuff that's been published recently, was the big trigger was the availability of a ton of international travel that comes in and out of New York City on a regular basis. And that had a lot to do with what started COVID-19 in New York City. I think most of us believe that here in Massachusetts, at least in eastern Massachusetts, the thing that started the arrival of COVID-19 was that big Biogen conference. In Western Mass, we're pretty sure it was somebody from outside Western Mass, we just don't know where, that started the original set of cases in Western Mass. And if you look at the data nationally, it's a big country and there's a lot of different things going on in a lot of different places. And one of the reasons why the federal government has talked about moving assets, especially ventilators, around from one state to another is because most of the modeling they're looking at implies that different parts of the country are going to get hit at different times. There isn't going to be one national surge for the United States of America. There's going to be a whole series of surges that are going to take place. They're going to be based on when the virus first showed up in certain places and what people did to deal with the consequences associated with planning for it. I've said before that I really appreciate, and I'm going to look right at the camera when I say this, the seriousness that the people in Massachusetts have brought to distancing and staying at home and only going out for essential reasons and purposes. There are obviously examples where people didn't abide by those standards, but in the vast majority of cases, people have lived up to that. I do think that will have an impact on the peak. But in terms of how long the peak lasts or how long this whole thing lasts, I guess what I would say is we're going to listen to the experts, some of whom are standing up here right now. We're going to talk to our colleagues in the healthcare community. We're going to think about what life could be like once we get past this. But I will be incredibly careful about not permitting this insidious, awful, and horribly dangerous and contagious virus from coming back anytime soon. And I think that's got to be the way we all look at this. And I get the fact that the economic consequence, well, I've talked to you about the unemployment numbers. I mean, I get the fact that the consequences of all this are severe. But the reason we're doing this is to keep people alive and to keep our healthcare system from getting so overwhelmed that it isn't able to do the things it can do for people who they can save. I mean, one of the great tragedies of this virus in other parts of the world has been in places where, because the healthcare system got so overwhelmed by it, they weren't able to do the things they normally do every day to save people's lives. And yet all kinds of people who ended up passing away, not because they had COVID, but because the system just wasn't prepared or able, given what it was dealing with on the COVID side, to deal with what was going on elsewhere in the healthcare system. So I think everybody needs to be really careful about presuming that we're all going to wake up one day and snap our fingers and things are going to go back to the way they were, because we all need to understand that while there is a race going on to create treatments, and many of the folks who are involved in that are right here in Massachusetts, and there's a race going on to find a vaccine, and again, many of the folks who are involved in that are right here in Massachusetts. Those answers at the earliest are probably 6, 7, 8 months away, and the vaccine is probably more than that. And I think we need to be very careful about drawing too many positive conclusions from much of any of this at this point in time.
Why is the team in so much
Sent out their police departments to fine people who are not heeding the advice. Is that something that would encourage other communities to get out there and make sure that people are doing this?
Well, we've said many times that there are certain things we think we can do at the state level, and there are certain things where I hope we provide a framework that locals can choose to pursue what they think makes sense underneath that. And then there are some cases where we take information we get from locals and make decisions to change some of the statewide guidance. The decision we made to go to 40% occupancy requirements on grocery stores came from a lot of the on-the-ground feedback we were getting from local boards of health and from mayors and city managers and others about what they were seeing in grocery stores. The decision we made to ban parking at all of our beaches was a decision that I hope sent a signal to a lot of other communities that have their own beaches that this would not be an unacceptable notion if they chose to do that themselves. We've supported many of the initiatives that local communities have pursued to make real in their own terms, based on what they were seeing on the ground, the orders we have out on essential businesses and on staying at home and all the rest. And I think for the most part, that's been a reasonably effective strategy. And I don't think anybody on our team has ever once said that a community that chose to do something on their own that was either a little more or a little different than what we did, we had a problem with. We're all trying to do the same thing here, which is to create distance, reduce the spread, and limit people's contact with one another.
Can you
On that
explain
note,
a little bit about
have
why
any more
it is?
thought to the letter from healthcare workers that urges you to do things like close all public spaces and limit gatherings of any size to curb the spread?
So our gathering at this point is 10. And there are many communities that have pursued different strategies around enforcing gatherings generally. We've also said no athletic events, no close contact, none of that stuff should be going on in public spaces. But, you know, I worry that as we think about these issues, we forget about the fact that being outside and taking a walk, to get back to the comments the Lieutenant Governor made about mental health status and some of the issues associated with never leaving your home, there's a lot of research that says that people in stressful times and situations need to take a walk, that it's a really important part of how they maintain some degree of equilibrium. And the reason we banned the parking at the beaches wasn't because we don't want people who live in those areas to be able to take a walk on the beach. The reason we banned parking was because people were going way beyond the message that we've put out there with respect to social distancing and, you know, hanging out in big groups, more than 10, even in some cases less than 10, but very close together. They were setting up barbecues outside, sitting 5, 6, 7 across the front of a car. This is exactly the wrong thing to be doing at this point in time. But I think, you know, we can't be everywhere. And part of the reason we create this framework is so that our colleagues in local government have what they believe is both the moral authority as well as the legitimate authority to do what they believe they need to do to execute on a strategy that everybody understands. And I think for the most part, that's been a pretty effective way to go about doing this.
Governor, when it comes to that $600 benefit, can you explain
Go
why
ahead.
the state won't be taking applications?
Well, I'll get back to you, Charmin, but, you know, say again, Christian?
At schools, expectations that they will reopen on May 4th, and it's getting put, do you expect to have to extend?
Yeah. We're obviously talking to Commissioner Riley at DESE and to Jim Pizer at Education, as well as to many of the folks at the local level, superintendents and others about the rest of the school year. I don't, you know, I've said many times, I think our position on a lot of these issues is we'll make a decision on them when we think we need to. At this point in time, I think we would be concerned about writing off the rest of the school year, especially given how incredibly uneven the online process or the remote education process has been across the Commonwealth. And if we do end up in a situation like that, we are going to have to come up with some kind of a strategy to try to help all the kids who didn't get what they're supposed to get over the last 4 or 5 months of this year, get some of that back. This is, you know, the public health issue is real. There's no question about that, which is why we all made the decisions we made with respect to school in the first place. But we talk a lot about some of the inequities that come about as a result of a lot of this dislocation. There's a big inequity going on right now associated with education, and we need to make sure that we recognize that, appreciate it, and deal with it.
Governor, an MIT-affiliated study of municipal wastewater is putting the actual number of cases at well over 100,000 in Massachusetts. Are you aware of that study, and how do you explain the disparity in the deviation?
I'm not aware of that study. How long has it been out?
I think just a few days now.
We'll certainly take a look at it. We're in pretty close contact with a bunch of folks at MIT, although it's a very big place. So I don't know. Have you talked to any? Yeah. I do believe you can use that to do some pretty interesting research. We talked to some people at MIT who were doing some pretty interesting research on that around surveillance with respect to the opioid issue. So that's a legit methodology. I'll be anxious to take a look at the study.
Governor, can you talk a little bit about that group of people who won't be able to get their benefits, their $600 benefit, until the end of the month when the state starts taking applications? Why is it taking so much longer for them?
The main reason for the difference between the traditional unemployed folks who are in the unemployment insurance system and the folks who aren't, the folks who get 1099s or are self-employed, is they don't exist anywhere other than in the tax system if they actually paid taxes and lived in Massachusetts last year. So the first thing you have to do is actually create them as a person in a system that can then process an application for them based on the fact that you will have to build out all the data associated with who they were, where they worked, what they did, how much they got paid, and then figure out how to pay them 50% of whatever that number was without having. The beauty of the unemployment insurance system, for all of its warts, is that every week companies are filing data on behalf of their employees and themselves and making contributions into the system. So when someone applies for unemployment, if they put the right name of the company in there and they get the rest of those fields filled out correctly, it bounces right off against a file that said, yep, that's this person, they work for this company, that's what they got paid, here's 50% of what they made up to a certain amount plus the $600, which is why 250,000 people a week after we got the guidance from the federal government about how to do the core piece of the system are going to get a direct deposit that's exactly right, that has all the right information in it. We're going to have to build a completely new platform for hundreds of thousands of people. And we believe in the program, okay? We advocated for it, we supported it. And I would love to be able to flick the switch and pour all that data from sources all over the place into some file and bring it to life. But it's going to take a few weeks to do that. And if we can figure out a way to get the resources out earlier and to come back and reconcile the thing on the back end, we'll do that. But these folks, for all intents and purposes, aren't part of a system that everybody else pays into. They are brand new. And we are going to have to build some platform that can actually take all that information in, validate and verify who they are, determine what it is they actually made, be pretty comfortable we know what that number is, and then give them 50% of that number plus the 600. And we will do it. It's just going to take a few weeks.
I'd like to follow up on what the Lieutenant Governor was saying. Are we hearing an uptick in domestic violence cases over the last couple of weeks since people have been sheltering?
Well, we know that the presence of sexual assault and domestic violence continues, unfortunately. What we are concerned about is the lack of reporting. So we have seen that the hotline number of calls in is down, for instance. So the purpose of the message today is to alert through providers, through Jane Doe, through the Department of Public Health, that these services are still available, even though not in person, they are available remotely. Emergency rooms are open. SANE nurses are available for forensic purposes, and that there are sort of information for individuals who are stuck at home to be able to develop a safe plan and to have strategies and have an outlet should they feel unsafe or they feel vulnerable or they feel sick because of the emotional stress that's upon them if they are in the presence of an abuser more often than they would be under more normal circumstances. So we appreciate your willingness to share these numbers to get this information out with us.
Secretary Saunders, could I ask you a question? You can step up to the podium if needed.
Bring your glasses.
Come on down. We're in touch with a certified nursing assistant from Holyoke who's recovering from COVID-19. She spent a week in the hospital and tells us that they withheld a week of pay from her. I wonder whether this is proper, whether the state should get involved and stop this kind of thing from happening to healthcare professionals.
We actually have created some, so I don't know the circumstances, obviously. One, I hope the individual is obviously recovering. Two, we actually, for people who don't have enough sick time and leave time, we actually created about 2 weeks ago a process for public employees, state employees, to actually borrow against future leave time. So they should not be being people who, so if she didn't have any leave time available to her at this time, for whatever reasons, she'd be able to borrow against future leave time so that you would get paid. That is not a policy of us to not pay people who are out sick, particularly during the COVID-19. So I'm going to need to, I will look into it. So that's just not our policy.
Secretary Summers, following up
Yep,
The
yep.
the machine for the N95 masks, I was wondering if one of you could speak to which hospitals will be sending their masks, and if it will include mainly partners hospitals, or if it will, and if it will include hospitals on the Cape, those
Yep,
in West
it's-
Massachusetts?
So one of the beauties of when there were several Battelle machines available, I think it was an early morning conversation of Dr. Klebanski, CFO, with me, and we were determining which one of us was going to leap on licensing this machine, and partners stepped up. It is available to any hospital and first responder system in the Commonwealth, including the Commonwealth of Massachusetts. So so the Commonwealth of Massachusetts will have a licensing agreement with Battelle, and so when we send in the masks, it's like a laundromat. I mean, I hate to reduce it to what it really is. It's like you put the dirty masks in a special bag. It would say the Holyoke Soldiers Home on it. It would get cleaned and come back. And then I pay for the N95s that I have had cleaned, just like any other hospital that wants to participate in this outside of the partner system would have a licensing agreement with Battelle. They would ship their dirty, their contaminated N95s, and then you pay it as on a per piece basis for every N95, and it's available not just for healthcare, it's for anyone who are using N95s. So it's really, and as I think Dr. Klebanski said, while it exists in Massachusetts and Somerville, I'm assuming that they're open to outside of Massachusetts, and it has the capacity for 80,000 masks a day. And when the opportunity became available to us, of course, as we have been searching, looking for N95s, when this became available as a way to preserve equipment, and you heard the numbers. I mean, in Massachusetts, we anticipate it's about 4.4 million N95 masks a month during the height of the COVID-19 crisis that we need not just to be able to bring equipment in, but also to safely reuse it again.
Secretary Summers, the reporting with the ethnic and racial is very helpful. Are you any closer to town by town? I've seen Connecticut's.
Yeah, I saw Connecticut's.
And they did one for every community.
Right.
Are we going to be seeing that soon?
Well, what I really want, so my first goal is to take that large number of missing and unknown and to be able to obviously reduce it as much as possible and to be able to put out by city data. But the first goal I have is it's just not acceptable. And that's why not only was it important yesterday to put out, you always have this debate in public health that you want data to inform your decisions, like precision public health. And so you always want, my friends in public health always want to have the perfect data available. When I looked at that data and realized how much was missing, I felt it was important to put it out for several reasons. One is it's really important for us to have race and ethnicity data available. Second is, in some ways, is to shame individuals, if you would, to complete all the fields, right? So that's why it's not acceptable to me that this 56% comes in unknown. And three, then sign a public health order, basically the moral obligation to provide that data. So my first goal is to really get as much data available on a statewide basis and then be able to put it out by municipality.
Thank you.
Thanks, Robert.
Yeah.